Welcome to the exploration of systemic sex therapy. We're diving into an approach that views sexual well-being through the lens of relationships and broader systems, rather than just individual concerns.
Exactly. It's about understanding that our sexuality doesn't exist in a vacuum. It's influenced by our partners, families, cultures, and even our past experiences. So instead of solely focusing on, say, a specific sexual dysfunction, we look at the bigger picture.
Think of it like this. If a plant isn't thriving, you wouldn't just treat the wilting leaves, you'd check the soil, the sunlight, the water, the whole environment. Systemic sex therapy does the same for sexual health.
And a key part of that environment is understanding the multifaceted nature of sexuality. It's not just about the physical act. It encompasses our emotions, our sensuality, our identities, and our relationships. It's a comprehensive understanding.
So we're not just talking about anatomy and physiology, though those are important too. We're talking about the whole ecosystem of our sexual selves. So what exactly does a sex therapist do? It's more than just talking about the birds and the bees, right?
Exactly. A big part is having a comprehensive understanding of sex. We're talking sensual, emotional, and physical. It's not just about the mechanics.
Makes sense. So do you need to be a walking anatomy textbook?
Well, a solid foundation in anatomy and physiology is crucial. Many clients have misinformation about how their bodies work. Knowing the sexual response cycle inside and out is key for client education.
What if someone has a physical issue?
That's where referral comes in. Knowing when to send someone for a physical exam or to a specialist is a must. We're not doctors, but we need to recognize when medical intervention is needed.
And what about the impact of, say, aging or illness?
The impact of aging and illness on sexual relationships is huge. Chronic pain, hormonal changes, it all plays a role. We need to be equipped to address those concerns.
Sounds like a lot to keep up with. Any good resources?
Absolutely. Bancroft's book is a classic, and it's being updated, which is fantastic. It's a valuable resource for any sex therapist.
Let's talk about Masters and Johnson. Their 1966 study on human sexual response was truly groundbreaking. It was one of the first to really delve into the physiology of sex.
Absolutely. They observed and documented thousands of sexual acts in a lab setting, which was pretty revolutionary at the time. They identified the 4 phases of the sexual response cycle: excitement, plateau, orgasm, and resolution.
Right, and that model became the standard for understanding sexual function. But it's also faced criticism. Some argue that it overemphasized the physical aspects of sex, neglecting the emotional and psychological dimensions.
That's a valid point. Focusing solely on the physical can be limiting. Sexuality is so much more complex than just a series of physiological responses. However, their work provided a crucial foundation. It opened the door for future research and helped to destigmatize conversations about sex. It gave us a common language to discuss sexual function and dysfunction, which is essential for effective therapy.
Let's delve into the sexual side effects of antipsychotics, a crucial area for sex therapists. We'll start with the typical antipsychotics.
Okay, like chlorpromazine, also known as Thorazine?
Exactly. Chlorpromazine can lead to decreased libido, erectile dysfunction, ejaculation difficulties, and even priapism, which is a persistent, painful erection. Fluphenazine, or prolixin, is also known to cause sexual dysfunction.
What about thioridazine or Mellaril?
Thioridazine carries a risk of erectile dysfunction, ejaculation and orgasm difficulties, and priapism as well. Haloperidol, or Haldol, can cause erectile dysfunction and painful ejaculation. And pimozide, or AP, may result in decreased libido, plus erectile and ejaculation difficulties.
That's quite a list for the typical antipsychotics. What about the atypical ones?
The atypical antipsychotics also have their share of potential sexual side effects. Clozapine, or Clozaril, is associated with priapism, diminished sexual desire, and general sexual dysfunction. Ziprazone, Geodon, can sometimes lead to anorgasmia, which is the inability to achieve orgasm.
And risperidone or Risperdal?
Risperdal may cause orgasmic dysfunction, priapism, and vaginal dryness. Olanzapine, Zyprexa, is linked to decreased libido and priapism. Finally, quetiapine, Seroquel, can also lead to decreased libido and priapism. It's important to remember that these are potential side effects, and not everyone will experience them. Let's talk about how antidepressants, specifically SSRIs, can impact sexual function. It's a really common issue and something therapists need to be aware of.
Absolutely. SSRIs like citalopram or Celexa, escitalopram, Lexapro, paroxetine HCl, Paxil, fluoxetine, Prozac, sertraline, Zoloft, and fluvoxamine maleate, Luvox, can all potentially lead to decreased libido.
Exactly. And it doesn't stop there. Many people also experience orgasm difficulties, ejaculation difficulties for men, and even erectile dysfunction. For women, vaginal dryness is another potential side effect.
It's a lot to consider. And while less common with SSRIs, some individuals might even experience priapism, which is a prolonged and painful erection.
Now, MAOIs, like isocarboxazide or Marplan, can also cause erectile dysfunction. It's crucial to have these conversations with clients so they're informed and can discuss options with their prescribing physician. It's vital that therapists create a safe space for clients to discuss medication side effects, especially concerning sexual function.
Absolutely. Many people are hesitant to bring up these issues, either out of embarrassment or not realizing the connection to their medication.
Proactive inquiry is key. Therapists should routinely ask about libido, arousal, orgasm, and overall sexual satisfaction. Don't wait for the client to initiate.
Think of it as part of a holistic assessment. Just as we ask about sleep or appetite, sexual function should be a standard question.
And it's not just about asking, are you having any problems? It's about creating an open dialogue. How satisfied are you with your sex life? Or have you noticed any changes since starting your medication?
Normalize the conversation. Reassure clients that these side effects are common and manageable. Knowing they're not alone can be incredibly validating.
Plus, open communication allows for collaborative problem solving. Maybe a different medication, dosage adjustment, or even targeted interventions can help mitigate the side effects.
Exactly. The goal is to empower clients to advocate for their sexual well-being and work with their healthcare providers to find solutions.
So, how can a systemic approach help when psychiatric meds mess with someone's sex life?
It's about seeing the bigger picture. It's not just about the individual experiencing the side effect, but also their partner and the relationship itself. For example, SSRIs can cause delayed orgasm, impacting both partners' satisfaction.
Right. So, what strategies can therapists use?
First, open communication is key. The therapist can help the couple discuss the issue without blame. Then, exploring medication adjustments with the prescribing doctor is crucial. Sometimes a different medication or dosage can make a big difference.
What if medication changes aren't an option?
Then we look at alternative treatments. Things like sensate focus exercises can help couples reconnect physically without the pressure of intercourse. Also, addressing any underlying emotional issues that might be contributing to the problem is important. Remember, the goal is to improve overall well-being, not just fix a symptom.
Let's consider a 45-year-old man, John, experiencing erectile dysfunction after starting an SSRI for depression. Systemic sex therapy looks beyond just the medication side effects.
Exactly. The therapist would first explore John's medical history, understanding the dosage and duration of the SSRI, and any past experiences with sexual dysfunction.
Then, the therapist would delve into John's relationship with his partner. Are there communication issues? Has intimacy changed since starting the medication?
It's also crucial to assess John's individual beliefs and attitudes about sex. Is he putting too much pressure on himself? Is he accurately informed about the potential side effects of his medication?
The therapist might suggest open communication exercises for John and his partner, focusing on expressing needs and desires without judgment.
They could also explore alternative sexual activities that are pleasurable and don't rely solely on erection. The goal is to reduce anxiety and rebuild intimacy.
If the side effects are unbearable, the therapist might collaborate with John's prescribing physician to explore alternative medications or dosages. Ultimately, systemic sex therapy addresses the biological, psychological, and relational factors contributing to John's erectile dysfunction, offering a holistic path to improved sexual well-being.
Let's talk ethics. When sexual dysfunction stems from psychiatric meds, we're navigating tricky waters.
Absolutely. First, informed consent is paramount. Clients need to know before starting medication about potential sexual side effects. It's not enough to just hand them a pamphlet.
Right. We need to actively discuss these side effects using clear, non-technical language. Decreased libido or difficulty achieving orgasm. Spell it out and document that conversation.
And confidentiality is key, as always. Sexual concerns are incredibly personal. Clients need to feel safe sharing these issues without fear of judgment or disclosure.
What about collaboration? We're sex therapists, not prescribers.
Exactly. We need to work closely with psychiatrists and other healthcare providers. If a client is experiencing sexual side effects, we can advocate for medication adjustments or explore alternative treatments. It's a team effort.
And remember, our role isn't to push clients off their meds. It's to help them make informed decisions and find strategies to manage the side effects, whether that's through therapy, medication changes, or other interventions.
It's about empowering the client to have agency over their sexual health, even within the constraints of their mental health treatment.
So, to wrap things up, we've covered a lot of ground in systemic sex therapy. It's not just about the physical act, but understanding the whole person.
Exactly. It's about having that comprehensive understanding, the sensual, emotional, and physical aspects all intertwined. And let's not forget the importance of anatomy and physiology. Clients often need accurate information.
Absolutely. And knowing when to refer someone for a physical exam or to a specialist is crucial. Plus, the impact of aging and illness can't be ignored. These factors significantly affect sexual relationships.
And remember those psychiatric medications? Being aware of their potential sexual side effects is vital for supporting our clients. SSRIs, for example, can impact libido and orgasm.
Open communication is key. Encourage your clients to discuss any concerns they have, especially regarding medication.
So, a systemic approach, awareness of medication, open communication, it all comes together.
Definitely. And if you're interested in diving deeper, seek out further information and training. Bancroft's book is a great resource, and there are many other avenues for learning.
It's a rewarding field, helping people navigate their sexual lives with knowledge and compassion.